Welcome everyone. This was Birth and Baby Talk. I'm Leanne Palmerston from Hamilton Family Doulas and one of your hosts. And this week I have some amazing guests from just down the road from me in Mississauga. I have Justin and Nelin. Hello and welcome.
Hi. Thanks for having us.
Thank you for coming. Why don't you tell us a little bit about what it is that you guys do?
Okay, sure. So we are a multidisciplinary clinic that is open in Mississauga now. We're in Streetsville. We actually just opened in January of this year, so it's been an interesting year.
How would you open a business, right?
Yeah, who could have known, right? So the clinic is called Myofacial Mississauga, and it's called that because we focus on myofascial release as a technique, and can get into more of what that is later, but also on chronic pain and women's health. So we are both physiotherapists, and we are the co-owners of the clinic.
Awesome. And today we're going to talk about scars, specifically about C-section scars. Mm-hmm. So what role would you guys play around C-section scars?
Absolutely. It is very complex the way that scars behave in your system over the months or years after they've been introduced into the body. I've seen clients with C-section scars who have resultant chronic headaches, deep pelvic pain, leg numbness, difficulties with taking a deep breath, the rib cage expansion, those kinds of issues. So the effects can be wide-reaching, and it's definitely different person to person. It just depends on how that scar matures and what the effect of that scar is. Often scars that happen in an emergency situation, which is more emotionally charged, are also more likely to have a deeper effect on someone's perception of their health, well-being, and mobility, and their willingness to do the kinds of self-care activities and get back into things like deep breathing, yoga, meditation, mindful activity that would allow people to recover more easily from their surgeries. That also can play an effect on how that scar affects their function long-term.
Yeah, I mean, I know from my work that there was a switch in the 70s and 80s from the classic sort of T-shaped scar that most people used to get, which was a low transverse scar and an upright scar through the midline, over toward what, the Pfannenstiel sort of bikini cut, which is that low transverse, but very, very sort of minimally sized one. And I know that that was because of people's body perceptions. Like women, suddenly you got a C-section and then your body looked kind of wrecked and distorted. And so, yeah, and the surgery trends have changed in order to try to help with that. And I guess the way those scars heal too has a lot to do with people's perceptions of their bodies.
Yeah, and one thing to note about that sort of up and down scar that was happening along the midline, another part of the reason for going to that transverse scar is the one that goes along the midline. It actually hindered recovery of the abdominal muscles even further. So for many of us, myself included, who've been through pregnancy or have had a C-section, there is this risk for what's called a diastasis recti, where the abs separate during pregnancy and delivery, and then have a hard time like kind of stitching back together after. And creating a surgical scar along that same line made it even harder. And what's important, so it's really great that now the scars are almost all transverse. So it does allow for the healing to be more accessible, I guess. But what's really important to know about scars in general, no matter what the size or shape, is that when you have a scar like that that's so deep, it doesn't just affect where you see it, right? It's not just superficial. It goes through multiple layers of human tissue. And
any adhesions or fascial restriction that's created after that scar heals, it goes very deep and can affect so many different structures. So it's not just your skin. It can affect your musculature, the fascial network 100%, your lymphatic system, all sorts of things.
Yeah, I think that was also one of my big things that blew my mind when I learned more about C-sections was, I think most of us have this impression that you cut into the skin and the fat layer and then a baby pops out. And all of these structural things going on inside the body that you have to kind of like cut through or saw through a little or move out of the way or completely take out and move out of the way. Like it's an incredibly efficient surgery because it's one of the most performed surgeries in Canada. But it's also like it's super efficient, but it's kind of complicated actually.
Yeah, I mean, I think the sort of trend of increasing elective C-sections sort of made it seem like this more glamorous or really easy thing, like an easy, like in and out sort of thing. But it's still major surgery, and we see tons of patients who are experiencing, like Justin mentioned, other issues because of their C-section scar years down the road. They're still struggling with something, and it's really hard for them to put together the pieces to know that, hey, like maybe this chronic back pain I'm feeling could be linked to the C-section I had 10 years ago. And that's kind of where we come in, is to help them make that connection and then also help them resolve that fascial restriction that's creating that issue.
So I think you're hinting at it there with that fascial restriction. What is going on that is causing, it seems a no-brainer that there could definitely be some like localized discomfort and things surrounding the scar, maybe some puckering in the scar and everything. But when someone starts to maybe have a funny kind of back or pelvic pain or things that seem like they wouldn't be related, what's the connection there?
It's something I could rant on and on about. I love telling the story, but basically, if you imagine your body three-dimensionally like a knitted sweater, every cell, blood vessel, bone, nerve, organ.
I'm a knitter, so this is a really
there you go. Perfect. Yeah, so if you imagine every cell is embedded in the system, and the structure, the shape, the position of the cells are determined by this fascial network. When you experience aches, pains, traumas, even emotional stressors, we alter lines of tension and pull to absorb and distribute force. It's protection. I don't want to feel that, so I withdraw. Or I've been injured, I'm not going to move that way anymore. And the problem is we're so good at avoiding positions of previous trauma or discomfort that we actually create these subconscious bracing and holding patterns against those movements. So now we learn to move the body in a different way, which isn't always necessarily well adapted to function long term. So then you add to this that when there's these imbalances that exist for any period of time, that the fluid around the connective tissue actually changes, it dehydrates, it becomes more viscous and sticky. So what you get is these imbalances get glued down by your body's own physiology and can exert up to 2,000 pounds per square inch of force on itself.
Wow.
So we're talking crushing pressure on pain-sensitive nerves, blood vessel, and muscles. So what people often experience in their scar short-term, it makes sense to them. I have a wound, the wound is healing. But long-term, because we're so good at avoiding the sensation, we literally kind of withdraw our conscious awareness from those areas. It's not until a therapist who is mindful of the potential effect of scars starts to touch or feel into that scar, and you go, oh gosh, that really hurts. Or even if it's not necessarily pain, it's like a deep guttural, oh God, don't touch me, this feels really disgusting and yucky, like a protective, kind of evolutionary, like we're gonna get away kind of sensation. It's the scar's sensitivity that's still there because the imbalance was never addressed.
Okay, that makes a lot of sense.
Mm-hmm.
So yeah, when you look at it like that, where, in the sense of knitting, right, there's a single thread and it twists in upon itself to create structure. And when we look at the body like that everything's a part of something else and connected to other multiple pieces to hold the whole thing together. it really does make sense that this scar that might be down close to your pelvis and your groin could be causing problems like in your mid back or in your thighs, or giving you headaches.
And where the connection comes from is that as the tissue heals, the wound itself is never as pliable as the surrounding tissue. It's not the same consistency. So what you have is something that is tight and now, tight and holding, that's now pulling on the neck structure, which is pulling on the neck structure. And that's where you get this three-dimensional torsion through the system that can, as I described before, reach upwards, downwards, straight back. And that's where these various symptoms can come from.
Like when you get a pull in your knitting,
Exactly. Beautiful sweater.
You can't just like sort of pull that thread back. You have to kind of work around that area to try to draw the one thread back in. And so, and it creates a funny line of tension where you least expect it. So yeah, this is a very good analogy for me. I hope it resonates with a lot of our viewers too. But okay, so that makes a lot of sense. Now, if we're healing, we're actively healing from a C-section, what can we do to optimally heal so that we're not creating that torsion where it's possible for us to affect that?
Yeah, so in the acute kind of recovery phase that you're mentioning, where you've maybe just had a C-section, and by the way, this applies to almost any kind of scar. So if you didn't have a C-section but you had an episiotomy, it's also relevant for you. The number one rule about scar work in any profession is you have to wait until the wound is closed. Okay, so your stitches are out, the wound is completely sealed, and there's no active infection going on. That's really important too. So once you've got full skin closure, that's when you can start your kind of like initial stages of scar massage.
Yeah, so after the wound is fully healed, usually you don't want to start any significant direct pressure on a scar until at least 8, 12 weeks or so. You could, as part of that kind of reconnecting with an area that is experienced as a trauma, perhaps do just some gentle, hand-on touch over a scar with just that visualizing of warmth, wholeness, connection, that kind of thing in the early stages. But once you actually get to working on a scar, you start with gentle direct pressure on that scar, and you just hold and you wait for any sensation of yuck or soreness or pain to dissipate. As the scar continues to mature over the coming months, what you can then do is you start to put direct pressure in, and then once that discomfort goes away, now you're going to apply a shearing force. So if you imagine that you kind of push in and then you kind of do a clock, so now you're feeling for which angle or directionality creates discomfort. And whichever is the most uncomfortable, that's your 12 o'clock. You hold there until it goes away. Oh, that's tender too. Hold there till it goes away. Oh, that spot's tender. And you basically work your way around to where you started again and gently ease off.
Okay.
Yeah.
That sounds good. And so you would continue that, I guess, until you feel like there's no yuck sensation or no triggering?
Pretty much. What I typically recommend clients when we're working with scars for the first time, usually patients are coming and seeing me after the scar's already several years old, but I'll say you work on it daily for a week, right? And in that time, it may take 5, 10, 20 minutes for that scar to feel fully like it's back to normal again in that session. But if you work on it daily for a week, you get to the point where there's so little sensitivity left that maybe once a month in the shower, just poke yourself and say, is the scar tender? No? Great. I'm going to go about living my life and having a great time for another month, and we'll check next time, right? And you just make it part of the routine to explore where you have wounds, where you have injuries, and see if they still bother you.
Okay, that makes sense. And you said, you just referenced that a lot of people come to see you regarding scars after the fact, like well after the fact, a couple of years after the fact. So if I've had a C-section a few years ago and I'm feeling like I don't like my scar, I can feel some pulling in it, or I hate when I'm washing myself in the shower and my hand maybe touches the area and I get that sort of revulsion feeling that we've been talking about, that I don't want to touch it, I don't want to go near it. What can I do at that point? Like, I can still work on it even though my scar's many years old?
Yeah, totally.
Yeah.
So I just want to speak to that really quickly because
Sure.
that was my experience, 100%. And it feels hypocritical because I am a physiotherapist and I know about these things. But it's funny how you can kind of disconnect from the knowledge that you have and just sort of listen to your feeling, right? It took me about 10 months or so postpartum to even touch my scar for the very first time. And part of that was what Justin was mentioning earlier was that sort of like emotional component of the surgery. So mine was an emergency C-section, and it was a very stressful emergency C-section. I'm sure there aren't any that aren't stressful, but those emotions that I sort of held onto were triggered by working on the scar. And that was really scary, right? I didn't really want to go back there to that moment. But truly, you sort of need to sort of get over the hump, if that makes sense, or really process the emotions that went through your body. And my scar took about 2 years to really finally get to the point where I could work on it consistently, and it was no longer raised, and I didn't have that yuck tight feeling anymore, because I definitely had tenderness in my scar, and I had tightness. So even when I would try to do sort of like an extension stretch, I could feel the pulling, like sort of upwards, and then if I wanted to put any pressure on it, it was still tender up to 2 years after. So totally normal, and I think that might be why some of our clients wait that long to come see us. But also, again, it's that sort of connection of not sort of putting two and two together of, okay, well, my C-section scar is bothering me, but that's normal, right? But this back pain I've got, that's not normal. But I'll let you elaborate on working on old scars.
A tricky part about scars in general, it doesn't have to be C-section. It could be an appendectomy. It could be, some other surgical procedure that's been done, is that the brain has like a blueprint for where everything should be in space. There's this like sensory motor understanding of this is here, this is there, this sensation I feel in my body is coming from this region, and what feels normal and what doesn't. When a surgery of any kind is introduced, you're knocked out, you're unconscious, usually C-section, obviously, or you're awake and just, anesthetize waist down, but it oftentimes, the muscle memory for what just happened to you is definitely 100% still present and still there, even if the physical sensation of what happened to you is not because of medication. So there ends up being this sort of mismatch between what your body anticipates things should be like and where things are and what they feel like, and what you actually experience after a surgery, which can be incredibly traumatic and uncomfortable, which is where this dissociation comes from as well, and this desire to not have to think or feel about it at all.
Yeah, for sure. Okay, so because I can imagine that you would just assume that whichever way your scar healed, that was the way things were going to be, right? So even if you were aware that there were like scar related localized things going on, you probably just assumed, well, that's just what I have to live with. That's not the case.
No, it's not. And this is another misnomer, just not directly related to scars, but we see clients all the time who say, oh, well, this is just part of getting older. I'm supposed to feel this way. I'm supposed to start losing bladder continence. And it's not true. But the only difference is that you've now had an imbalance that you've held longer, and therefore it affects you more, right? So the sooner you start to reconnect with what it feels like to be in your own skin and helping yourself feel well and move well through scars, through your body in general, and getting the muscles engaging the way you want to, the sooner you can go back to living your best life, and at the same time decrease the potential effects of these things later in life as well.
Yeah, that makes a lot of sense. So you guys have described like what we can do as soon as the scars are like well healed, so what we can start to do to address some stuff like some adhering or prevent some adhering, and certainly after the fact, things that we can do. At what point does it make a lot of sense for a physiotherapist to step into the picture?
Yeah, I would say if you've got any other funny business going on, really. I mean, truly, my personal opinion on physiotherapy and postpartum is every single woman should get physiotherapy after they deliver. And I think it should start right in the hospital when you are about to be discharged. There's lots of, your body's just gone through a huge, massive shift, right? And so just the experience of the delivery, and then changing, you know, the amount of weight now you hold in your body, and all of your ligaments starting to like kind of come back together, and your organs going back to where they were. And then also like reapproximating those abdominal muscles, that's all starting to begin. So you really want to be able to have the tools to figure out how to encourage all that good healing. So first and foremost, I think every woman should have it in hospital. But afterwards, you know, you give yourself that period of time to heal, and you can start that gentle scar massage. And I think with every new mother, there's always kind of this like period where we just don't even leave the house because we're just, you know, like figuring out our new babies and things. But I hear it from a lot of women, it starts pretty soon after, and they ignore it for a long period of time. So it's like a pelvic pain that they didn't have before, or a back pain they didn't have before, or a new shoulder pain, or anything that you notice that is new, essentially. That would be a good time to come and see a physiotherapist, because they can help you with these imbalances that were created during pregnancy and then postpartum after delivery, because it's important to remember that your body changes a ton structurally in such a short period of time. 9 months, it feels long when you're going through it, but it's really short in the grand scheme of things. There's lots of structural shifts happening, and so it's almost uncommon for someone to go through or pregnancy, labor, and delivery and not have some new issue crop up that they didn't have before. So if that's you, or if it's aggravating something that you had before, then, you know, definitely that experience has altered things that we can kind of sort of look at and tease out and figure out where to start, because working on your C-section scar is important, but if it has already been long enough that it's created other fascial restrictions, other areas of the body, then we can help you sort of release those and then sort of bring it back down to normal, I guess.
So to boil it down, definitely if you feel symptoms at rest that you can't address with, you know, just gentle mobility, or, you know, like castor oil or whatever it is you're doing to try and help the scar as it matures, definitely if you get back into your normal exercise or movement routine and things don't feel right, you don't feel stable, or things actually create pain, and then definitely if you notice an obvious diastasis recti greater than, I think the clinical margin is 2.7 centimeters or something like that, right? So anything greater than about an inch or so is too much, right? And it may affect the way that you are engaging your core and potentially knock out your pelvic floor musculature when you're trying to do anything involving low back. So you definitely want to see somebody to help with those.
Okay. Yeah. So, I mean, obviously, those kinds of like seemingly unrelated aches and pains and weirdnesses are signs of a deeper issue that we really can't get to from the surface, right? I mean, you would be working from the surface, but we don't know what we're looking for.
Yeah, exactly.
And it's right in there in your name too. I want, like, this was something I had no idea. Like, when you're talking about these facial connections and torsions and things, you're talking about the fascia itself, right? Like that underlying substructure, that sort of, I sometimes call it like the plastic container that holds all your insides in. If we think of our bodies as like,
sausage casing.
Yeah, it's an interesting analogy, but it doesn't quite do it justice.
No, I know. Do you have a better one?
I could get into a whole side thing, right? But the best guess as to how consciousness actually works in the body is that your body communicates as a second nervous system through the fascia as a hollow tubule for the vibration, light, energy, and sound. So again, this is a much larger conversation. I don't have the background in terms of research to really give you a good understanding of it. But the premise is that when we are removing consciousness from the body because something is painful, that the restriction itself is literally a removal of that awareness, right? And as you restore motion and mobility, you're allowing your awareness to return to a region which gives you more control over the muscle activation, the movement, and mobility, right? So if anybody really wants to see what the anatomy looks like, the French plastic surgeon who first started looking at all this stuff, he has his first video he ever did on YouTube for free. It's called Strolling Under the Skin. It's like 15 minutes long. It's originally in French, so it's like dubbed in English, but it's really cool. You get to see how the body organizes three-dimensionally and see what scars actually look like and how it affects the pliability of the tissues. So anybody who's a visual learner, I strongly encourage to check it out.
Yeah, I think I might go and look for that.
It might weird you out at first because it is in vitro, like it's in a living tissue.
Yeah.
Wow.
If videos of surgery freak you out, you might not like that. But
good thing.
can you imagine it is a lot of people do think of it like that sausage casing, right? Like, you know, if you've ever cooked a piece of chicken, like an uncooked piece of chicken, there's kind of like that white sheath that you pull off. That's what fascia looks like in dead tissue, essentially. But in living tissue, it is much more three-dimensional. So it's not just a sheath. It's not just that layer right underneath the skin. Because it's three-dimensional, your fascia supports every cell in the body. So not just the connective tissue aspect of it, but the skin, the blood vessels, the nerves, the muscles, the ligaments, brain tissue, bone tissue, everything. So there's this sort of like running joke in the fascial community that there's no such thing as a knee. Because if you look at it from a strictly fascial point of view, there is no separation like we think of traditionally in anatomy, where we have, you know, bone, and then you have muscle, and then you have nervous, and you have skin, you have all these different layers or compartments. But if you look at it from a fascial point of view, there is no separation. So that's why working with the fascia, and that's why we're so passionate about working with the fascia, is so powerful, because you can affect all these different systems at the same time.
Fascinating. That's really fascinating. Because, yeah, I don't think of it as, I mean, I realize it runs through the entire body and plays multiple roles, but I don't think of it as interconnected with as much as it is interconnected with.
Yeah, and I think that's sometimes the missing piece for a lot of people. You know, we tend to see people who have chronic issues, and they're chronic because they've tried all sorts of different kinds of treatment, and just nothing has quite gotten them to where they want to be. And sometimes it's just that missing piece of, you know, there wasn't the right practitioner to address the fascial network to really get that lasting change.
Yeah, part of that is, we didn't address this earlier when I was talking about the 2,000 pounds per square inch. What do you do with that, right? Sure, you put direct pressure in. Why does that help if it's that much pressure? What's been shown is that the time component is huge. So 1.5 minutes, the elastic part of the tissues release. It's elastic band. If you let go, it shortens back up again. At 3 minutes, the fluid I described that gets all gluey and sticky begins to rehydrate. But, you know, for another analogy, this would be like a Jell-O mold at the end of a party. It's slimy and yucky looking, but it's still shaped like Jell-O. At 5 minutes or more, the Jell-O actually melts and your body releases its own anti-inflammatories and blood vessel opening chemicals. So you actually get chemical and mechanical changes, right? And this is what allows you to actually restore movement patterns and create long-term change in symptoms.
So that's really what you want to look for when you're getting any kind of fascial treatment. It's that time component and the pressure component. So if somebody's working on you and they're doing a technique that's more like oscillatory, like they're putting pressure on and off, or there's all these like fancy new gadgets out there, like massage guns or fascial guns and stuff. The problem with those is that they put the pressure on and they take the pressure off, right?
Yeah.
So you don't get that sustained pressure that you really need to get that melting. So you need sustained pressure plus at least 5 minutes of sustained pressure to get that melting. So if you're seeing somebody who's doing a fascial technique and it's not getting you to where you want to be, that could be the issue, is that they're maybe just not giving it both of those components, the sustained pressure and the time.
Yeah. You also don't want to force the system. There are tools out there, and I won't name any, just to make sure I don't get in trouble with anyone, but anything that involves you trying to force the system, it can't be forced, right? And you will end up creating more damage or irritation or pain. So it's about engaging the barrier and waiting.
Gently.
Yes, exactly.
It's not like we're not trying to build muscle by sort of stressing the muscle and then it build stronger. We're trying to sort of like gently have things kind of realign and start functioning correctly again.
Exactly. You restore the motion and the lines of pull so that the body's natural strength can take over. And where there are some mild limitations in strength, perhaps from lack of use for long periods of time, you build stability there. And then you get back to the activities that you enjoyed doing anyway so that you can become stronger.
Yeah. Awesome. Well, thank you so much. This is so much to think about. I mean, I honestly think nobody thinks this much, like the average person doesn't think this much about scars and functions and interconnectedness and how we can potentially avoid a lot of issues by paying a little attention up front to our scars as they're sort of like hitting that sweet spot, like from the time that they're like technically healed to in that sort of interstitial point where we want to make sure nothing funky starts to happen.
Yeah.
So,
the good news though, there's still hope. Even if it's a 30-year-old scar, there's still potential to be able to get that release.
Okay, that's good news. That's going to be really good news for a lot of people. So, yeah, I don't have any questions today for us, but I want to thank you guys for coming on. And I think I'd love to have you guys back on again, talking about more stuff. So we can talk about that. But thank you so much for sharing your time today with us and your expertise, because I think this is going to make a lot of people's lives better.
We hope so. That's the whole point, right?
Absolutely. So thanks, Justin. Thanks, Nelin. Folks, you can find them at Myofacial Mississauga. And if you are not in the GTHA, then if you're one of our viewers outside of Toronto, Hamilton Nexus, then you're going to want to look into a physiotherapist who has a specialty in
myofascial release.
John Barnes myofascial release is the.
There we go.
Yes.
Yeah.
Thank you so much. I hope everyone has a wonderful week. If you are not signed up to our newsletter, you need to get signed up. I will drop the link in the comments. And also just a heads up that it's the Black Friday, Small Business Saturday, and Cyber Monday coming up. And I know we are having a sale in Hamilton at our Toronto agency and our Ottawa agency. So keep your eyes peeled on our social media and our newsletter if you were considering having some doula support in your life. And we'll see you next week. Take care, folks.
Bye. Thank you.